Hey guys, the patient we're going to discuss today is Mr. Ryan Harvey, who is a COVID-19, also known as coronavirus survivor. Mr. Harvey also experienced a 4-week-long coma, who also had kidney failure and blood clots to his lungs. Due to the coronavirus symptoms and side effects, as well as being in a coma for an extended period amount of time, Mr. Harvey needs to regain majority of his function back, including walking, talking, consuming food, as well as completing any other ADLs. Mr. Harvey also expressed difficulty when it came to tasks that involved functional reaching. Mr. Harvey's family is very excited and are very supportive of his therapeutic journey, especially his wife. And they are very excited to have him return home. Mr. Harvey has goals of being able to walk and consume food independently as possible to return to his prior level of functioning. During his interview process for the evaluation, I would ask a series of questions about his home life and who he is as a person, as well as anything else outside that can be a possibility. One question would be, besides your wife, does anyone else live at home? Does he have any other family relatives in there, children, grandchildren, or anyone that lives directly at home with his wife? With that being said, is his wife home majority of the day, or is she home all day? If she's not home all day, are there any family members or close friends that live nearby that can come in case of emergency or if he needed help? Also, is he able to walk around the house safely as well as easily without the potential risk of him falling or further injuring himself? Also, how many stories is his home? Are there a lot of stairs in his house that he needs to go upstairs and downstairs to reach his bedroom or the bathroom? If there are no stairs inside his home, or if there are stairs inside of his home, are there stairs outside of his home to enter and exit the house? And can he safely do that? As said in his profile, we talked about some prior level functioning goals, such as walking and eating independently. However, does he have any other specific goals that he wants to achieve during his occupational therapy? As well as what kind of activities does he like to do? Or does he have any outside hobbies or inside hobbies that he enjoys doing that we can further adapt and implement into his therapeutic treatments? One purposeful activity I would administer to Mr. Harvey would be the patient completed low intensity bilateral upper extremity therapeutic exercises, including elbow flexion and extension, shoulder abduction and adduction, shoulder flexion and extension, to start out with 2-pound weights for 2 sets of 10 to 12 repetitions with supervision and modeling, also with verbal cues, with rest breaks as needed to adjust bilateral upper extremity strength and activity tolerance to increase his independence with ADLs. A preparatory activity I can do would be the patient completed tabletop activities while standing with increased time and verbal cues with rest breaks as needed to adjust standing tolerance and activity tolerance to increase independence with functional mobility. And for an OBI, I would do the patient completed light meal prep while seated through functional reaching tasks with verbal cues and increased time. Mr. Harvey has been through a lot, and there are a lot of things that he is very looking forward to do back independently. Starting out with these tasks such as ADLs and all these activities would help further enhance his therapeutic journey, as well as help him regain the function that he needs to become as independent as possible.